What are the unique challenges faced by older adults, and how do you approach addressing them in a compassionate and effective manner?
Older adults often face a combination of physical, emotional, and social challenges that require a thoughtful and compassionate approach to care. Physically, they may experience chronic conditions such as arthritis, diabetes, or heart disease, as well as age-related mobility issues or sensory impairments like reduced vision or hearing. Emotionally, feelings of isolation, depression, or anxiety may arise due to the loss of loved ones, diminished independence, or changes in their roles within families and communities. Socially, they may encounter barriers to accessing healthcare, transportation, or community resources, which can exacerbate feelings of vulnerability. In my practice, I approach these challenges by first ensuring a thorough assessment of the patient's individual needs, preferences, and limitations. I prioritize open communication, listening attentively to their concerns and encouraging their active participation in care decisions. This helps build trust and ensures that the care plan aligns with their personal goals and values. For physical challenges, I collaborate with interdisciplinary teams, including physiotherapists, dietitians, and occupational therapists, to create tailored interventions that promote mobility, manage pain, and maintain overall health. For emotional well-being, I make it a priority to create a supportive and empathetic environment. I often recommend or facilitate connections with mental health professionals, support groups, or social activities that can help combat feelings of isolation. Additionally, I advocate for the use of assistive technologies or adaptations in their living environment to enhance their safety and independence. Educating family members about how they can provide support without undermining the patient's autonomy is also a key part of my approach. By viewing each older adult holistically and involving them in every step of their care, I aim to address their unique challenges with the respect and compassion they deserve.
Describe your experience in assessing and managing chronic conditions common in the elderly population, such as dementia, diabetes, heart disease, etc.
My experience in managing chronic conditions in the elderly population has been both extensive and rewarding. Conditions such as dementia, diabetes, and heart disease require a comprehensive, patient-centered approach that balances clinical expertise with empathy and understanding. In cases of dementia, my focus begins with conducting detailed assessments to evaluate the patient's cognitive function and understanding the progression of their condition. I work closely with families to develop care plans that prioritize safety, routine, and emotional well-being. Techniques such as reality orientation and reminiscence therapy are tools I frequently use to enhance quality of life. I also monitor for associated issues, such as depression or agitation, and collaborate with physicians to adjust medications or non-pharmacological strategies as needed. For diabetes management, my approach involves patient education on monitoring blood glucose levels, recognizing symptoms of hypo and hyperglycemia, and adhering to dietary and medication plans. I emphasize self-management skills while remaining vigilant for complications such as neuropathy or wounds that may require specialized care. Regular check-ins and coordination with dietitians and endocrinologists ensure the patient receives comprehensive support. When caring for individuals with heart disease, I routinely assess vital signs, monitor for symptoms of exacerbations, and educate patients and caregivers about lifestyle modifications such as low-sodium diets and appropriate exercise routines. Medication adherence is crucial in this population, so I work diligently to simplify regimens and ensure patients understand the importance of compliance. I also assess for symptoms of anxiety or depression, which are common in patients with chronic cardiovascular conditions, and provide appropriate referrals. Across all chronic conditions, my approach is holistic, considering not only the physical aspects of care but also the emotional, social, and psychological impacts these illnesses have on the patient and their families. This involves effective communication, ongoing education, and strong collaboration with interdisciplinary teams to provide the highest quality of care tailored to each individual's needs.
How do you ensure effective communication with older adults who may have cognitive impairments or sensory deficits?
Ensuring effective communication with older adults who have cognitive impairments or sensory deficits requires patience, adaptability, and a keen understanding of their unique needs. I focus on creating an environment that minimizes distractions and fosters trust, which is essential for meaningful interaction. For older adults with cognitive impairments, such as dementia, I tailor my communication style to their level of understanding. I use simple, clear language and avoid medical jargon, breaking down complex information into manageable pieces. Repetition, paraphrasing, and visual aids can be helpful tools to reinforce understanding. I also pay close attention to nonverbal cues, such as body language or facial expressions, to gauge their comfort or confusion. Establishing a calm, reassuring tone and maintaining a warm demeanor helps reduce anxiety, making communication more effective. When addressing sensory deficits, I adapt my approach to the specific impairment. For those with hearing loss, I ensure that I am facing them directly so they can see my lips and facial expressions. Speaking slowly and clearly, without raising my voice, helps avoid distortion, and I use written materials or visual aids when necessary. In cases of visual impairments, I describe actions clearly before performing them and ensure that written materials are available in large print or accessible formats. Tactile methods, such as a gentle touch on the arm to signal attention, can also be helpful. Additionally, I always encourage their involvement in the conversation by asking open-ended questions and giving them ample time to respond. If a family member or caregiver is present, I engage them as needed, while ensuring the patient remains at the center of the conversation. By being patient, empathetic, and resourceful, I strive to maintain the dignity and autonomy of older adults, even when communication barriers exist.
What strategies do you employ to promote independence and quality of life in elderly patients?
Promoting independence and quality of life in elderly patients requires a balance between providing necessary support and empowering them to maintain as much autonomy as possible. My strategies center on understanding each patient's unique abilities, preferences, and goals, and designing individualized care plans that foster their strengths while addressing their limitations. A key aspect of my approach is encouraging active participation in their care. I involve patients in decision-making processes, whether it's choosing daily activities, setting health goals, or planning their care routines. This not only respects their autonomy but also boosts their confidence and sense of control over their lives. I also focus on enhancing physical abilities through tailored interventions. For example, I collaborate with physiotherapists to design exercise plans that improve strength, balance, and mobility, which are critical for reducing fall risks and maintaining independence. For those with chronic conditions, I provide education on self-management techniques, such as monitoring blood sugar levels in diabetes or managing medications effectively, to enable them to take an active role in their health. To address emotional and social well-being, I encourage social engagement by connecting patients with community resources, support groups, or recreational activities that align with their interests. Building and maintaining social connections significantly enhances quality of life and helps combat feelings of isolation or depression, which are common among elderly individuals. Adapting their living environment to support independence is another crucial strategy. I assess their homes for potential hazards and recommend modifications, such as grab bars, proper lighting, or assistive devices, to create a safe and accessible space. For patients in care facilities, I advocate for the use of technology, such as tablets or communication aids, to help them stay connected with loved ones. Ultimately, my goal is to empower elderly patients to live fulfilling lives with dignity, ensuring they feel supported without feeling dependent. By addressing their physical, emotional, and social needs in a holistic manner. I strive to enhance their overall quality of life and promote a sense of purpose and well-being.
How do you balance the physical and emotional needs of older adults?
Balancing the physical and emotional needs of older adults requires a holistic and patient-centered approach that recognizes the interplay between their physical health and emotional well-being. I begin by conducting comprehensive assessments to understand their medical conditions, emotional state, and social circumstances. This helps me tailor care plans that address both dimensions in an integrated manner. For their physical needs, I focus on managing chronic conditions, promoting mobility, and ensuring pain management. Regular monitoring, medication management, and collaboration with interdisciplinary teams are essential in maintaining their health. I also emphasize preventive care, such as encouraging proper nutrition, hydration, and appropriate exercise, to enhance their physical resilience. At the same time, I remain attuned to their emotional needs, understanding that physical ailments often impact mental health. For instance, pain or mobility limitations can lead to frustration, anxiety, or depression. To address this, I ensure that my interactions are empathetic and supportive. I actively listen to their concerns, validate their feelings, and offer encouragement to help them cope with challenges. Creating opportunities for social engagement is another critical strategy. Whether it's facilitating visits with family, recommending group activities, or connecting them with support networks, I strive to combat feelings of isolation and loneliness. I also encourage activities that bring them joy or a sense of purpose, such as hobbies, volunteering, or spending time with pets. Communication plays a vital role in balancing these needs. I maintain open and transparent discussions, involving the patient and their family in care decisions. By fostering trust, I ensure they feel heard and valued, which contributes significantly to their emotional well-being. Ultimately, my goal is to create a harmonious balance where physical health supports emotional well-being and vice versa. By addressing the patient as a whole person, rather than focusing solely on isolated symptoms or conditions, I can help them achieve a better quality of life.
Describe a challenging situation you encountered in geriatric nursing and how you resolved it.
In one particularly challenging situation, I cared for an elderly patient with advanced dementia who was experiencing significant agitation and refusing to eat or take medication. This behavior was not only impacting their physical health but also creating distress for their family, who felt helpless and concerned. To address the issue, I first took time to understand the underlying causes of the patient's behavior. Agitation in dementia patients can often result from discomfort, unmet needs, or environmental factors. I observed the patient closely and noted that they seemed particularly restless during mealtimes, which suggested that the environment or the way food was being presented might be contributing to their distress. I implemented several changes. First, I adjusted the environment to reduce overstimulation by ensuring a calm, quiet dining area with minimal distractions. Second, I used a patient-centered approach to build trust. By speaking softly, maintaining eye contact, and using reassuring touch, I helped the patient feel more at ease. Additionally, I modified the presentation of meals, offering finger foods that were easier to handle and more visually appealing. These adjustments made the patient more willing to engage during meals. For medication administration, I collaborated with the interdisciplinary team to explore alternative forms, such as liquid formulations or mixing medication with food, ensuring the patient received the necessary treatment without escalating their agitation. I also educated the family on effective communication techniques and ways to support the patient during difficult moments, empowering them to feel more involved in the care process. Over time, these interventions significantly reduced the patient's agitation, improved their nutritional intake, and eased the family's stress. This experience reinforced the importance of looking beyond surface behaviors to identify root causes, involving the patient and family in solutions, and tailoring interventions to meet individual needs. It was a reminder of the resilience and adaptability required in geriatric nursing, as well as the profound impact of compassionate, personalized care.
How do you stay up to date with the latest advancements in geriatric care?
Staying up to date with the latest advancements in geriatric care is essential for providing high-quality, evidence-based care to older adults. I make it a priority to continually expand my knowledge and skills through a combination of formal education, professional development, and staying informed about current research. One way I stay updated is by attending workshops, seminars, and conferences focused on geriatrics. These events provide valuable opportunities to learn from experts in the field, engage in discussions about emerging trends, and gain insights into innovative practices that can enhance patient outcomes. I also participate in online courses and certifications tailored to geriatric nursing, which help me stay informed about advancements in areas such as dementia care, chronic disease management, and end-of-life care. I regularly review reputable medical journals, research articles, and guidelines from organizations such as the American Geriatric Society, AGS, or the International Association of Gerontology and Geriatrics, IAGG. These resources provide evidence-based recommendations and highlight best practices for addressing the unique needs of older adults. Collaboration with colleagues and interdisciplinary teams is another vital aspect of my professional growth. Sharing knowledge and experiences with peers allows me to learn from diverse perspectives and integrate new strategies into my practice. Additionally, I actively seek feedback on my care approaches, which helps me identify areas for improvement and adapt to evolving standards in geriatric care. Finally, I embrace technology to enhance my learning. I use apps, webinars, and online forums to stay connected with the global geriatric care community. This enables me to keep pace with the latest advancements and ensures that I am always prepared to deliver the best possible care to my patients. By combining continuous education with practical application, I am able to remain at the forefront of geriatric care and adapt my approach to meet the ever-changing needs of this population.
What is your approach to preventing falls and other common geriatric injuries?
Preventing falls and other common geriatric injuries requires a proactive and multifaceted approach that focuses on assessment, intervention, and education. Older adults are often at a higher risk due to factors such as decreased mobility, balance issues, vision impairments, or medication side effects. My strategy involves addressing these risks holistically to create a safe and supportive environment. The foundation of my approach is a comprehensive risk assessment. I evaluate the patient's physical condition, including their mobility, strength, balance, and any chronic conditions that might contribute to fall risk, such as arthritis or neuropathy. I also review their medications to identify potential side effects, such as dizziness or sedation, that could increase the likelihood of falls. Environmental factors, such as poor lighting, clutter, or uneven flooring, are also thoroughly assessed. Once risks are identified, I implement personalized interventions tailored to the patient's specific needs. For instance, I encourage exercises or physical therapy programs to improve strength, flexibility, and balance. I also recommend the use of assistive devices, such as walkers or canes, ensuring that they are correctly fitted and that the patient knows how to use them safely. Environmental modifications play a crucial role in prevention. I advocate for the installation of grab bars in bathrooms, non-slip mats, adequate lighting, and the removal of tripping hazards like loose rugs or electrical cords. In care facilities, I ensure that call bells are within easy reach and that frequently used items are accessible to minimize unnecessary movement. Education is another vital aspect of fall prevention. I work closely with patients and their families to teach them about potential hazards and safe practices. For example, I advise patients to rise slowly from sitting or lying positions to prevent dizziness and encourage the use of proper footwear with non-slip soles. Engaging families in the process helps reinforce these practices and provides additional support. Finally, I maintain ongoing monitoring and reassessment to adapt the care plan as needed. By addressing physical, environmental, and educational factors in an integrated manner, I strive to minimize fall risks and promote a safer, more independent lifestyle for older adults.
How do you collaborate with other healthcare professionals to provide comprehensive care for elderly patients?
Collaboration with other healthcare professionals is essential to providing comprehensive and holistic care for elderly patients. Older adults often have complex medical, emotional, and social needs that require input from a multidisciplinary team. My approach to collaboration involves clear communication, mutual respect, and a patient-centered focus. The process begins with a thorough assessment of the patient's condition and needs, which I share with the relevant team members, such as physicians, physical therapists, occupational therapists, social workers, dietitians, and mental health professionals. Each team member brings unique expertise, and I ensure that their insights are integrated into a cohesive care plan that addresses all aspects of the patient's well-being. Effective communication is the cornerstone of successful collaboration. I participate in regular team meetings, case conferences, or care rounds where we discuss patient progress, share updates, and resolve any challenges collaboratively. I actively listen to others' perspectives and ensure that my own observations and nursing assessments contribute meaningfully to the discussion. A key part of my role is serving as an advocate for the patient, ensuring their preferences and values are respected in the decision-making process. For example, if a patient expresses concerns about a proposed treatment, I communicate these to the appropriate team members and work with them to find alternative solutions. In addition to formal interactions, I maintain open lines of communication with colleagues, whether through face-to-face discussions, emails, or shared electronic health records. This ensures continuity of care and allows us to quickly address emerging issues, such as changes in the patient's condition or unexpected challenges. Collaboration extends beyond the immediate healthcare team to include the patient's family and caregivers. By keeping them informed and engaged, I help bridge the gap between clinical care and daily life, ensuring a seamless and supportive experience for the patient. Ultimately, by fostering a culture of teamwork and mutual respect, I contribute to a comprehensive care model that prioritizes the health, independence, and dignity of elderly patients.
What are your long-term career goals in geriatric nursing?
My long-term career goals in geriatric nursing reflect my passion for improving the quality of life for older adults and advancing the field of elder care. Over the years, I have developed a deep appreciation for the unique challenges and opportunities in this area of nursing, and I am committed to making a meaningful impact at both the individual and systemic levels. One of my primary aspirations is to specialize further in geriatric care by pursuing advanced education, such as obtaining a certification as a gerontological nurse practitioner, GNP. This will enhance my clinical expertise and enable me to take on a more autonomous role in managing complex health issues faced by elderly patients. I also aim to contribute to the development of innovative care models that integrate holistic, patient-centered approaches. In addition to clinical practice, I am passionate about educating and mentoring the next generation of nurses in geriatric care. I envision taking on roles as a nurse educator or clinical mentor, where I can share my knowledge and advocate for greater attention to geriatric care in nursing curriculums. By inspiring others to specialize in this field, I hope to address the growing demand for skilled professionals in elder care. I am also deeply interested in contributing to research and policy development to address systemic issues affecting older adults, such as access to quality care, ageism in healthcare, and support for family caregivers. Through involvement in research projects or collaboration with organizations focused on aging, I aspire to influence policies that enhance the standard of care for this population. Ultimately, my goal is to combine clinical excellence, education, and advocacy to create a positive and lasting impact in geriatric nursing. By remaining dedicated to lifelong learning and embracing leadership opportunities, I aim to be a driving force in shaping a more compassionate and effective healthcare system for older adults.